I want to talk about something that is highly, highly important. It's something that I came across a few days ago, and actually, it's a topic I have discussed with my mother. What I'm going to tell you, you may or may not know, but I'm going to help educate you. And it's also going to give you the reason why I have created a masterclass on this topic to spread awareness and to moving into 2026, you're going to understand that the traditional way of doing things, you have to, think outside the box and you can't keep doing the traditional way of getting a job. So, we are going to be talking about how minority business owners, women owned business owners, work in the clinical research space, how you can leverage, it's called the WMBE, Women Minority Business Enterprise Certification, how you can leverage that to gain pharma contracts. Yes, I said pharma, government contracts, state contracts. No one talks about this in this industry. I had no clue that it even existed. I had no clue that the certification process existed until my mother came to me and said, you need to, work on getting the certification because it's going to open up more doors for you as an entrepreneur. Not just because you're a business owner, not just because you have the certification, it is because the government has mandated a lot of the companies, your big companies, to work with minority owned business owners. And it's important for you moving into 2026 to learn how to leverage this certification because it's going to bring more eyes on your business and it's going to give you more credibility and visibility. I preach about this all the time, but it's so important to have a strong digital footprint on LinkedIn, on social media, having a website that is displaying the kind of content or source courses or services that you have to offer. Because again, whenever you are going on LinkedIn, and I use LinkedIn quite often and YouTube, because LinkedIn is where your B2B clients are. I mean, a strong, high-end B2B clients. And it's really more for busy professionals. Facebook is more kind of like, I feel like family and friends, social type of network. But with LinkedIn, it's very more on the business end. So it's best that whenever you get on there, you're talking about a problem that you're solving and it's going to, a problem that you can solve for your B2B clients. This is an untapped market from my knowledge. And again, it's not something that is talked about in this industry. If you don't know me, my name is Alicia Moore. I am the CEO of Clinical Science Research Solutions, and I'm also the founder of I Am Research and Wellness Foundation. And I'm going to be talking about some knowledge, not common knowledge, that is not discussed in this industry. And again, it's something that I learned from my mother. And even my mother, as a matter of fact, I sent her a picture on what I discovered the other night because I'm going through the certification process right now. And it takes about 60 to 90 days to know whether or not you've been approved. And if there are some glitches or if there's some errors you need to correct, they give you the opportunity to correct those errors so you can become a certified woman, minority business enterprise. You get that certification. Whenever my mother first introduced me to this topic of getting the WMBE, yeah, I thought about it. I did my research on it. But whenever I looked at the website, they were charging. At least that's what I thought. I said, well, this is something I'm going to have to look into a little bit later. But whenever we talked about it again, this was just not long ago, we did a little bit more of a search because she told me that they didn't charge me anything whenever I applied for this certification. And lo and behold, whenever I went to the correct website, applying for the WMBE is completely free. I'm very thankful that she introduced this new way of opening up my eyes to creating more revenue or having the opportunities to create more revenue for myself outside of the traditional role. Now, again, I am an entrepreneur. I'll say that again. And then I also work my day job. But as an entrepreneur, and in these days and times, you cannot look for a job the traditional way. It doesn't really work. So you have to figure out ways of diversifying your income. In this, and I've got some notes, in this clinical research space, of course, we're taught how to get the PI certification, CRC, CRA, ICH, GCP, understanding SOPs, the regulatory compliance, getting into that, medical writing, um, which is still very important. And if you're still going to stay in those roles, that's completely okay. However, you need to future proof yourself and start looking for ways of having extra revenue coming in and opening up those opportunities for you. A lot of times, some people, they don't want to do the work. Once they see how much work you have to put into getting registered for this certification, or even as an entrepreneur, most times a lot of people want to just stay in the employee role, which, I mean, that's okay. But you need to understand that sometimes that way doesn't work. You can get laid off for whatever reason, and then you don't have that extra stream of revenue coming in. So by getting this certification and by partnering with tech vendors that allow you to display your services to their clientele, you have a three-prong way of making revenue for yourself. So again, you have the traditional job that you're working. Now you partner with a tech vendor that has copious amounts of clients that can use your services. And now you have paved a third way of getting this certification, which leads you into getting government contracts, state contracts, and now pharma contracts. And these contracts are not small at all. So you're looking at not just small, $1,000. You're looking at multiple figures, even into the millions and sometimes billions, billions. I'll stick with the millions so we can get a grip on the opportunities and the money that you're leaving on the table whenever you do not expand your idea outside of the box. Because I'm on the entrepreneurial side, I like to teach people ways of doing things differently, showing up on LinkedIn differently, and not just complaining. Because to me, in this space, people don't really teach you the true way of becoming an entrepreneur and what it actually takes, the money you have to invest for yourself. I'm going to tell you, whenever I opened up my business in 2023, obviously I didn't spend that much. I didn't make anything. 2024, still didn't make anything. It was a loss. 2025, I did, but I have spent more money because I needed a marketing team. I needed a grant writer. I needed a whole bunch of other things to help me brand my business and to expand it, because it was getting to the point to where a lot of this work I couldn't do on my own. And it was time for me to implement certain services within my business and invest in myself so I can position myself to get these certifications or to partner with the multi-million-dollar tech vendor. That way I can start generating revenue for myself in ways that I never thought was even possible. We in this industry, we're not taught on supplier diversity, certification-based contracting, government mandated business opportunities, and how to leverage our minority identity as strength in the industry. I know a lot of times we come against a lot of adversity because we are minorities. However, if you have your own business, the government has mandated for companies to do business with you so you can make a living, so you can live a life I call of freedom. And so you can have more opportunities to make the money, to partner with organizations, to even go to webinars, or to even position yourself to have like TED Talks, because now you can talk about your journey as to how you got from point A to B as a minority when the odds were against you. And again, no one's teaching this. I said to my mother last night, I can't believe I haven't had not one person approach me about the WMBE, and there's a WSOB certification process. Not one. So again, I'm teaching you this, I'm telling you about it so you're more aware of what is actually going on and what you can tap into as a clinical research entrepreneur. And again, this is what shocked me. The government, as I mentioned before, they are mandated that corporations must do business with minority and women owned companies. It's not encouraged, it's not suggested, it is mandated. That means pharmaceutical companies, as I mentioned before, CROs, tech vendors, hospitals, academic institutions. They all have supplier diversity roles or goals that they have to meet, and they all have contracting requirements. And minority and women owned businesses, we sit on top of that. We sit on top of that list. So I encourage you to come listen to my webinar. We start next week on the 15th, and I'll be breaking down exactly what you need to do. And again, as I'm growing in this process, I will create more webinars to help you to understand how to be successful at this part of your business as an entrepreneur. Again, what does this actually mean for you whenever you get the WMBE or WMBE and WSOB certifications? It's increased contract opportunities, increased visibility, increased credibility, faster trust building, more doors are open within pharma. Because again, if you're trying to go the traditional way, that I've seen a lot of people enrolling or applying for these roles and they're really not getting anywhere. However, get you a legitimate business started. Now you have to register your business with sam.gov, get all that process. And I'll talk about that too in the webinar or during the 4-day masterclass next week. And if you're listening to this after that, I'll post the link in the chat so you'll have access to those recordings. And that way you can sign up and listen to the free 4-day masterclass on how you can be successful and how to actually start that process. Anyway, so again, what it means for you is more doors are open within pharma. Your eligibility for state and federal contracts, it skyrockets. Actually, you created another pathway because without it, it's going to be very difficult for you to land those contracts. My mother told me, I think she had let her certification lapse or whatever the reason was. She thought she was going to be able to get a contract with ease, and she had more of a difficult time getting it than whenever she went back. I think she went back and got the recertified, and she realized that, oh my gosh, it was so much easier landing a contract because she did have the WMBE certification. This is a long-term financial positioning. So you do not have to start with a giant company. I don't have a giant company. You don't have to start with 50 employees. You need the certification. You need clarity. You need a service that solves a big, huge business problem. Many of you have it and many of you don't. If you don't, you need to work on getting it. And so again, I'm hosting this masterclass for a reason because it's a topic that's not even discussed in this industry. You hear about the regular topics that are talked about, but for minorities, we really need to start doing a little bit more digging around. And sometimes you don't know what you don't know. And it may take someone like myself or another individual to open up your eyes to other opportunities that's going to help increase your revenue, your visibility, your credibility as an entrepreneur. You're leaving money on the table. I stress highly, get on LinkedIn, start creating content. Create content that is going to teach people what they need to know to be successful in life. So here's what you're going to learn in the masterclass. What the WMBE and WSOB certifications, what they actually are, how the contracting system works behind the scenes, why these certifications why they open doors, what's inside pharma, what's in it for you, what's in it for pharma. I'm going to also teach you how to align your business or expertise with the supplier diversity needs and how to position yourself for long-term opportunities in 2026 and beyond. Um, this is a blueprint that my mother gave to me. And then I've also taken off with it because again, this is not even discussed in the clinical research industry, but we're going to discuss it now. And yes, I will still be talking about site ownership and how to get a PI and what I'm doing. And this is part of the process. You know, whenever you're getting ready to open up your own clinical research site as a woman, minority owned business owner, this is something I'm going to be teaching you too. Even courses that's going to complement, you working on strengthening like your RFPs. You're working on strengthening, it's what they call, there's a couple different things that I wrote down. It's called the capability statement that you're going to need. It's a narrative statement that you're going to have to put in the, I think it's sam.gov portal. And we'll get into all that later. But just to let you know that this is an untapped market that you need to learn about, and I'm going to teach you about, and don't sleep on it. Again, the comments, check out the comments below. I will, as a matter of fact, I will go ahead and put the link for you to register for the 4-day event. Give me just a second. I'm looking for it right now. Oh, actually, it's right here. Oh, I don't even know what I did here. Not. That's a proper check. Okay. So banners. Let me create a banner and this is a definitely unscripted. Not unscripted, but okay. I don't know why that color is blue. It shouldn't even be blue. Anyway, so whenever you get ready to register, this is the link. And also, as I mentioned before, I'm going to leave it in the description, YouTube description box. And if you're looking at this YouTube channel after the fact, then at that point, what I'll do is I'll switch out I'll leave the link there, and then it will, we'll get you on the email list, and we'll go ahead and make sure you get the recorded sessions, because I really want you to succeed in the pharmaceutical industry. If you're working as an entrepreneur, just remember there are ways of monetizing, and it's not the traditional way. And I'm all for monetizing, but I'm also for thinking outside the box. And then here's another thing too, before I end this. Whenever you think about getting this certification, taking the time out to make sure you're ready for it, these contracts that you can land will supersede the regular 9-to-5 job. It will supersede the salary. I will tell you that now. And I talked about that before. So, and it can supersede your salary. Let's say you've been working for a year and you're making X amount. Well, some of these contracts, you can land one good contract can twice double. It can be double of what you're making now. Of course, taxes come into play. And also, if you have other products or services that you can have your marketing team to market as an evergreen. I've talked about this before, a way of monetizing. That's another way of, having a stream of income coming in. So again, let me re-emphasize. You have your day job, the traditional way of getting a job. Now, I will speak on my experience. I have partnered with a tech vendor. I have services I have to offer. They're not cheap services to the clientele that they have. Now I'm going through the certification process with the WMBE, WSOB certification process so I can land government contracts, state contracts, and pharma contracts. And again, can't wait to see you on the 4-day masterclass. I'll be teaching you exactly what you need to know. And as I'm going through the process, I will be teaching you even more. That way you are successful in being in this clinical research industry, and you'll be able to beat the odds that everybody else is plagued with. And you don't have to worry about recruiters ghosting you. Talk to you soon. And I hope you learned something. I will see you at the masterclass starting December 15th.